So the Drug Foundation commissioned this report alongside the New Zealand Needle Exchange Program, and they're represented here by Catherine Leaf, and Mātuaraki, which is the addiction sector workforce organisation, and Angela Brewer is representing Mātuaraki and Te Pou today, and she can take your questions as well. The reason we commissioned this report was just to add a little bit of, I guess, financial weight behind an issue that we've always said is the right thing to do. So as New Zealand has experienced in the last little while, we've proved ourselves ill-equipped to deal with public health emergencies when it comes to drugs. We've seen that most recently with the dreadful deaths from synthetic cannabinoids. But even before that, all of the struggles for people and families trying to get treatment, all of the lack of support in communities, the fact that we've got waiting lists, the fact that we only provide services to 50,000 New Zealanders every year when we know there's another 100,000 New Zealanders every year who want help. And all of that, the failure to address New Zealand's drug problem properly is down to the fact that for too long we have taken a punitive approach to drugs, colloquially known as the war on drugs. So all of our resources has gone for over 40 years into punitive approaches, into law enforcement, into the court system, into corrections, including prisons. So 80% of what the government spends on addressing the drug problem goes to the punitive response, and only 20% goes to a health response. And so it should be no surprise that we find ourselves ill-equipped when confronted with new public health emergencies to deal with that. And then if you look at how politicians respond to the drug problem, for too long they've talked about, the need to get tough on drugs, and anyone else who talks about an alternative is soft on drugs. And again, we've seen that most recently in Parliament in the last little while, with MPs squabbling over who's going to have the tougher sentences when it comes to synthetics. So we have a members' bill that increases the penalties. We've got another bill that wants to increase that from even further, and then we've got the government saying we want to make these drugs a Class A issue. And the reason that politicians do that, fight over who is tougher, is it's because it's in their political DNA. They're so used to it. Here is a drug problem, let's smash it out. Let's get tough. And therefore all of the resources, the government money goes to that. The consequence, the intended consequence of that, I would argue, is the health problems that we see. Failure for people to get help, communities not being resourced to deal with this issue. And so it's no surprise that we're in the position that we are. But times are a-changing. We've seen recently the Prime Minister go to New York, attend the United Nations General Assembly, where she talked about kindness, but she also refused to sign up to a statement led by President Donald Trump, which was essentially doubling down on a punitive response on this war on drugs. And she said, no, New Zealand is not going to sign that. We are going to treat this as a health issue. And then more recently, we've got ministers like Andrew Little, like David Clark, and even the Police Minister Stuart Nash saying, we want to go after the guys that are causing the problem, the traffickers, the importers, the manufacturers, but we want to provide help, to people who need it. We want to provide help to users. And even the police have been saying we can't arrest or we can't enforce our way out of this problem. Now, they've said that recently around the synthetics crisis, but they've been saying that for the last few years around methamphetamine as well. The police are saying we can't arrest our way out of this problem. So I think the follow-up question for journalists to police is, well, so you support a health approach then? And I actually think that you would find that that is the case. That a whole lot of people, the momentum now to treat this as a health issue is shifting. Last year at Parliament, the Drug Foundation launched what we call our model drug law. And that was to put some concrete steps behind what a health, treating this as a health issue would look like. It's great to have the language that this is a health issue, we're going to treat this as a health issue. But what does that look like? And so we presented to Parliament a three-stage approach to actually, concrete steps on how New Zealand could actually treat the drug problem as a health issue. So I want to outline what those three steps are and then hand it over to Shamubeel, who's going to disclose the money side of the benefits of that. So the three-pronged approach is this. The first one, and here we're learning from what's happened in Portugal, and we're also following the advice from the Law Commission. The first approach, which is learning from what's been happening in Portugal and what the Law Commission recommended to government back in 2001, is to decriminalise all drugs, is to replace our 1975 Misuse of Drugs Act with a health law that is focused with a new drug law that's focused on health. And so with a decriminalisation of drugs, you're actually acknowledging that this is a health issue, so why would we have criminal sanctions to people who are using drugs, people who need help? So that's no surprise to many people that let's do this, let's decriminalise all drugs, get a new drug law in place. But we want to back that up with actually treating this as a health issue, to try to rebalance the spending of where government money goes, to shift away from this 80% going to law enforcement and only 20% going to health, to more money going to health. So we've said to government, you need to double the amount of money that you put into treating drugs as a health issue. Government currently spends $150 million on alcohol and drug treatment. We're simply saying add another $150 million to that and invest in a wide menu of health services, harm reduction services in the community, as well as residential treatment beds and everything in between to really address, the unmet need that currently exists. If you are going to say that you want to treat this as a health issue, put your money where your mouth is. And when it comes to developing the 2019 wellbeing budget, we want to see, our expectation is that the government will put their money where their mouth is and commit to doubling the amount of money that goes into treating this from that health perspective. And the third strand to our model drug law is to create a regulated market for cannabis. Learning from what's happened recently in some jurisdictions in the United States and more recently in Canada, that cannabis is New Zealand's most common illegal drug. 50% of the country have tried it. And we're still trying to address the cannabis problem through a law enforcement approach. We're still criminalising people and we're not providing help to people who have a cannabis dependency. And simply governments have handed control of the cannabis market to the criminal black market. So we're saying regulate that market, take it out of the hands of the criminal black market and put tight regulations in place. The kind of regulations we would see for cannabis is what we currently do for things like alcohol and tobacco. Age restrictions, marketing controls, controls over who can sell it, who can buy it. And look, this is not a new thing now. We can learn from what's been happening in the US and more importantly, what's going to be learnt from Canada, who are quite similar to us. Let's take it out of the hands of the criminal black market and put controls in place so that we can address the issues of youth use and all the other harms that come with cannabis. Now, I'm not going to the big big unveil is coming now. I'd like to welcome Shamubeel Eaqub to the podium. We commissioned, the three partners commissioned Sense Partners to put some money alongside those three proposals. So over to you, sir.
Thanks, Ross. The issue of drug policy reform is really gaining traction, and so I was quite pleased to be a part of this. And part of it was the conversations that we have in day-to-day life, right? I mean, who doesn't know somebody who smoked pot? Everybody knows somebody. And if you haven't done it, you're missing out. Now, when you kind of look at the statistics, the reality is that huge numbers of people do drugs in New Zealand, But more importantly, there are some significant harms that are associated with it, right? So when the Ministry of Health commissioned the Drug Harm Index, they found that the cost to New Zealand is about $1.8 billion a year. The question is, are we doing the right thing in terms of resolving the costs that arise out of it? And the costs are manifold, right? There are costs to the individuals from dependence, from the health issues that might come from it, cost to friends and family, cost to community, but also the interventions that we make as government, right? This money that we spend on things like police, on interventions around health, all those bits and pieces. And while those things are happening, you take a step back and you realize that even the people who police it have moved on. The police are not locking up people for use and possession like they used to. Those numbers have been coming down over a long period of time because implicitly we understand that locking people up and a punitive approach to drugs is not working. The missing gap here is we don't have the resources and the funds available to actually treat the people we're not locking up. So we still have this unmet need, and this is the moral issue, that we have addiction issues, we have health issues, we have community issues that arise from drugs, but we don't have the resources in place to be able to look after these folk. And when you look around the world, the thing that becomes very clear is that there is an alternative approach. So this war on drugs, while we've been talking about forever, it has failed everywhere, right? It has failed everywhere, and the places that we should look to are places that are trying something different, and it seems to be working. And the first place to look, of course, is in Portugal, right? The evidence there from the early 2000s is extraordinarily positive. What they have done is decriminalize drugs, but put in huge amounts of resources to help people who have addiction issues and who want help. And this increase in funding and resources has meant that they have seen lower rates of harmful use and much better outcomes for people who were previously getting very negative outcomes. And when you look at the literature around the world in this particular space, the evidence is very, very strong that when you put some money into it, there is always a benefit that's bigger than the cost. So what it means is that actually there is just so much unmet need, that there is so much good that we can do. Any additional resources we put into it will actually be good for society. And that's all great, but there is a caveat here. And the caveat is that while it might be good for society, it may not be good for the government books, because it does cost more money to pay for things. And that is what the big challenge for any government and any kind of policy. And I'll touch on this in a bit later, but we need to be pragmatic when we talk about policy issues. Not just say that you should do this because it's the right thing to do, but also show people how you can implement it. That's practical, pragmatic, and sustainable. Now, one of the things that became very clear as we looked at the evidence from around the world is that the typical kind of benefits from these different types of interventions are very strong. So when it comes to things like prevention, so education and all those bits and pieces, the benefits or the returns on your investment are somewhere between 1.5 and 5 times. So if you put in $100 million, you'll be getting $150 million of benefits. So this is really positive stuff. When you think about harm reduction, so this is stuff like needle exchange, extraordinarily positive. And New Zealand was a world leader in this. And we made some massive gains, right? And we haven't been investing enough. We're not growing this stuff enough. And there is a huge amount of unmet need even in the existing harm reduction programs that we have now. So there is a real opportunity to increase funding here, and the benefits would be very positive. Again, from the literature, the benefits are really big, somewhere between 1.8 times and nearly 12 times. The ranges are really big because you don't know what your starting point is. If there's a huge amount of unmet need, those initial investments can have really big gains. And the final bit, of course, is in that kind of more the treatment and health side of things. And even there, the gains are quite big, but it's harder because there is a lot more work to be done. And the benefits can range somewhere between 1.5 times and 7 times. So if you think about the kinds of money we're talking about, $150 million, the gains that we can get out of it are really very, very significant. The motivation for a lot of this is, of course, the model policy that the Drug Foundation has. But from a more personal perspective, I think it's around doing the right thing. We have a moral objective in terms of how do we make sure that this thing that's failing is done better. But second, that we do it on the basis of evidence. When it comes to criminal justice and when it comes to drug policy, we're an evidence-free space. Everybody is, as Ross said, it's all about who can be the most punitive, who can seem the toughest to deal with this stuff, even though all the evidence says that approach does not work, will not work, and cannot work. When you kind of break it down in terms of the detail of it, it's pretty simple. When it comes to decriminalization, we will take a lot of people out of the criminal justice system and we'll put them into health, right? Brief interventions and health as they need. And that will make us better off by about $34 million if it's just decriminalization. The government is going to be better off by about $14 to $15 million a year. And most of the savings comes from the criminal justice system. And on average, the cost of putting somebody in health is half of that of locking them up and putting them through the courts and prisons. So we can double the amount of help we can give just by moving from a criminal system to a health system. But if we want to find $150 million, the government is not going to be able to do it from decrim alone. The legalization of cannabis comes with its own fishhooks, but if you look at what's happened with the US states and more recently in Canada, there are models that we can look at that would work here. And the most important gains you can get from it is you can bring it into the formal economy, you can make sure you can regulate the quality, the potency, who accesses it, all those other bits and pieces that we do with alcohol and tobacco already. So it's not like we don't know how to do it. So we have a lot of experience to be able to do this well. And we get to bring in a lot of that revenue off the black market from the criminal economy into the formal economy. And that gives us fiscal resource as well to be able to redeploy into the economy, but more importantly, into this particular problem. And when we look at the legalization of cannabis, we think conservatively, we would be raising $191 million of revenue, tax revenue for the government every year. That's sufficient money for us to be able to be very ambitious about the kinds of programs we want to have in dealing with the issues from drug use. And from a very pragmatic perspective, if you look at the current government's budget responsibility rules, that it doesn't have additional money to spend on anything, it wants to do the right thing, we would have to say that of course we should decriminalize because the Portugal experience shows that it works, it's the right thing to do. We should, of course, increase the spending on health and prevention and on treatment, but of course, it also costs a lot of money. Legalization is a little bit harder from a conversation perspective, but I think we need to do it if we're going to unlock that fiscal capacity to be able to do what we want to do. From a very, very personal perspective, if I kind of look at all of the evidence and all of the work that we have done in the last year and a bit, it's absolutely obvious that we have to do all of those three things together. We can't pick one. Because the reality is only if we put them in a package can we have the money to be able to do the things that we want, but also to do the things that are morally right. Thanks.
Thanks, Shamubeel. I'd like to welcome Catherine Leaf to the stage. She's provided a lot of research to Shamubeel around what kind of health interventions could be bought with that money, but also importantly, she helped us commission the report, which I'm truly grateful for. Catherine, to you.
Good morning, everyone. So I'm Catherine Leaf, Executive Director of the Needle Exchange Program here in New Zealand, and we welcome this report. And as a Needle Exchange Program, we are an organisation that is drug user based. So it's particularly important to me and it's particularly important to my colleagues. It has a very personal meaning. We've long argued for a health-based approach. The evidence shows that a health-based and not a criminal justice-based approach is the most effective response. And today we're presenting the economic evidence. I want to talk a little bit about harm reduction. Harm reduction is an essential component of any treatment model. Drug use is common, it's normal, and it's usual. It's important to work with people where they're at and how they understand and see their drug use. Harm reduction is also important because contrary to what you often read and hear, most people who use drugs don't actually develop a problem or need help from treatment, more intensive treatment services such as counselling and residential services. If we understand this, we can actually really understand why harm reduction is an integral part of a health-based approach. Because not only does harm reduction reduce risk to those people who themselves are using and those around them, but it actually helps prevent problems occurring in the first place and developing. Just over the last couple of weeks, we've had a visit from the Global Drug Policy Commission with our own former Prime Minister, the Honorary Helen Clark, and Madame Ruth Dreyfus, the former Premier from Switzerland. And we heard Helen Clark talk a lot about the need for more harm reduction in New Zealand, and quite a strong call for us to innovate and do more. We were the first country in the world to introduce a state-sponsored nationwide needle exchange program. We were a leader, and I think we need to lead again. And the needle exchange program is an example of the benefits of an economic case. HIV prevalence internationally amongst people who inject drugs is 13%. In New Zealand, 0.2%, largely due to the early introduction of needle exchange, which has saved hundreds of thousands of dollars of health costs. So, as we've just heard, our current focus is very much on a spend around law enforcement and criminal justice. We've got plenty of evidence this is a failed policy, and it's time for New Zealand to take a different approach. We know that at least 50% of New Zealanders will have used an illicit drug. And I want you to remember today that the war on drugs not only is a failed war, but it is also a war on those people who use drugs. And people who use drugs are our brothers, our sisters, our mothers, our fathers, and our sons and daughters. Thank you.
Thanks. Cool. So we're going to open it up for questions. I'll invite the Shamubeel and the two other sponsors to come here, and then if you fire your questions to people, and then they can get in front of the microphone so you can grab the sound. So the floor is yours.
Ross, what do you think the chances are of the government listening to this report, given you say it's in their DNA to want to smash the hard drugs?
I'm actually optimistic that the government will put their words into practice. So we have heard ministers and the Prime Minister saying this. Even the previous government said they want to treat this as a health issue. They haven't yet followed that up with actual action and resources into that. But we've got opportunities with the Mental Health and Addictions Inquiry, the review of the education sector as well, the justice sector review, and there's a wider review of the health sector. And they're going to launch what the so-called wellbeing budget. So I think we have the opportunity, with a changing momentum globally, with words, very good words that the government is now saying and actions they're planning, to back that up with actual action. So I'm optimistic we have the scope there to change. And if you look at some of the debates that have happened in the House recently, first around medical cannabis, but more recently around the synthetics, all politicians are saying we want to go after, when it comes to drugs, we want to go after the big guys, the guys that are causing harm, the traffickers and the importers, but we want to provide help to drug users. Well, if that's the case, if we've got consensus in that, they may not know that yet, but it seems that there is growing consensus amongst our politicians to genuinely treat this as a health issue, but they have to back that up with investment in harm reduction and prevention and in treatment.
Have you approached anyone in government with this report yet?
So you're the first. So this is this report is the launch of the report. Certainly the model drug law, we launched that in Parliament last year, and so that was sort of our gift to all politicians in the lead up to an election, to help them move away not just from the platitudes of treating this as a health issue, but the concrete steps. What can that look like? We now have an economic case that we can take to the finance minister and say, your ministers are saying they want to treat this as a health issue. The numbers stack up. It's the right thing to do. Please do it.
What about the regulated market and the fears raised by some around edibles and that kind of things, the gummy bears, that kind of stuff?
Well, I think the beauty of trying to put a regulated market in place is that you're actually taking it out of the hands of the criminal black market where there is no control. So there is going to be issues around the margin, around things like edibles and what's the purchase age, should it be 18, 19, 20? But you get to do that in a regulated market. And at the moment, that's controlled by the criminal underworld, who have no concerns for people who are currently consuming these drugs. So yes, we're going to have a debate around what do the regulations look like. As Shamubeel said, New Zealand, this is not new for New Zealand. We've regulated other harmful substances. And we get to learn from people who have gone before us with Canada and the US.
Do you think it'll take the wind out of the sails of the synthetic market, or do you think they're just different drugs and it's not going to have an impact?
I think there's different things that are happening. I think, yes, to a degree, safer alternatives would help address some of the synthetics problem. But I think the kind of insights that we've been gathering recently around who is using these drugs and why they're using them, they're people on the margins of society, they're homeless people, they're using these drugs to get that effect, which is to put them down for a few hours. A regulated cannabis market won't address that, but it could prevent some people shifting towards those more dangerous drugs.
How much weight does having these numbers add to your case for a health-based approach?
Well, I'm hoping that it, and you guys can have a turn too. We've always argued to take a health approach from it's the morally right thing to do. And we think it's backed up by good public health evidence and from other places around the world that have done this. I think with this report, we just wanted to add strength to an already strong argument that this makes economic sense and it pays for itself. So I think when it comes to the number crunchers like Treasury and the Finance Minister, if they're not persuaded on the moral side of this and the public health evidence, then maybe the numbers which stack up will help persuade them.
Shamubeel, can you just explain around the extra tax revenue that you said could be gained? How did
Yes.
you come up with those numbers? Is that based on what you estimate the number of users to be in New Zealand, or is that looking entirely overseas models?
No, so it's looking at how much we spend on cannabis now and what it's likely to do in terms of both the stuff that we buy, so the GST you pay on it, the retailers that pay taxes and wages, so all the way down to the producers. So we've counted all of those up. But we've been very conservative. So, when Treasury did this work a few years ago, they thought it'd be about $250 million. From a very much more detailed bottom-up analysis, we think, let's be more conservative. And even then, we come up with a tax gain of about $190 million a year.
So it could be much more than that.
Yeah, but you have to be careful because in the beginning there'll still be a black market. It's not going to suddenly disappear just because you've legalized it, right? So you have to be patient with these things. So again, part of it is being conservative because you want to know what the worst case scenario might be because that's what these estimates and these experiences will be held against. And when I think about the tax gains, and the reason why I focused on the tax gains is because it will be important from a political decision. If the money is not there, they're going to find it hard to get over the line. So despite all the moral arguments, public health arguments, those are good arguments, but the money still matters. So that's why we've looked at it fairly carefully. We've taken a very conservative approach, and we think the case is very strong.
What do you imagine if you brought cannabis into the formal economy would the price be when you compare it to what it is on the black market at the moment?
And so part of it is around the design of the market. So you don't want prices to fall a lot because that would encourage lots of consumption, right? So the last thing we want is lots of people out there smoking tokes. So the idea is that with this kinds of policy, we make sure that prices are just a little bit higher than they are now over time so that we don't encourage more users, but make sure that we have quality controls, potency controls, and age controls so that they're safer to consume. But if you bring prices down, then it is very likely that you're going to see an increase in consumption, and that would defeat part of what we're trying to do.
So I'm wondering if that's the case and if the criminal market would still be cheaper, what's going to encourage those people who have regular dealers and that sort of thing to move into...
You're speaking from personal experience here. Kidding. When you look internationally, what has happened is that the convenience and the accessibility of the legal market means that most people would prefer to just go to a shop and buy the stuff than go to a dodgy fellow to buy a tinny. Right? So part of it is around the convenience and all those things. So unless there is a big drop in prices in the criminal market, that wedge is not there. So we would like to see, when you kind of bring in when you bring it into the formalized economy, you'd want to make sure that you don't see big fluctuations in price. You want to make sure that things remain about the same, but you move it away from the criminal justice system, which has risk premiums built into it, right? So if you think about what the price of what you pay for a tinny, part of it's the risk premium the criminals take, right? The risk of getting caught. That coming into the formal economy means that we can get that into profits and into the supply chain. So I don't think that's necessarily a big concern. So the experience in Canada is going to be important because it's a national one. But the same experience in the US suggests that it's probably not going to be as big a problem as people think.
Ross, could I ask you, just to explain, one of the proposals is to decriminalise the use and possession of all illicit drugs, but to keep their supply illegal. How can you explain why you have people using it and saying, hey, that's okay, but people supplying them that drug are still criminalised?
When we developed the model drug law, we wanted to look at current evidence. And the current evidence is Portugal, who did that. So they decriminalised use, but they didn't decriminalise supply. And when the Law Commission did their work in 2011, they made similar recommendations around use and supply. So we're trying to inform our work based on that. There will be, as the Global Commission on Drug Policy have recently said, there will be an argument for regulated markets for other drugs, but we're not going there. We're looking at the Law Commission recommendations and the real-world example of Portugal.
I think it's about sequences, right? Let's move from this very punitive approach to something that's a little bit better, and then we can start making it even better over time.
And there's a political palatability, right? If a politician came out tomorrow and said we're going to regulate methamphetamine, I think that would be problematic from a we're realists. From a political point of view, I don't think politicians would go there. So what we're putting forward is what we think the evidence supports in real world examples, as well as what I think we can get across the line politically. And I think the political mood is shifting, but I don't think it would shift to, legalising or prescribing methamphetamine.
Yeah, but it is sort of ends up like a funny kind of market, right, where the person who uses the drugs, hey, decriminalised, but the person who gives them that drug.
Correct. Yeah. Oh, and yes, yeah, and that's the nature of the beast. We haven't done that for alcohol. With alcohol, we've let those large drug dealers continue to do that. But for this, we are realistic, but also there aren't models around prescribing or regulating methamphetamine. So we're going with evidence and real world examples.
What about personal, like growing for personal use? How do you kind of factor that into this whole equation?
Yeah, so I think so we haven't yet designed the perfect model yet for a regulated cannabis market, and we're really hoping the government will announce quite soon, what process they want to do to engage the public on helping design that. So I think all things are on the table. Where North America has, different parts of America have got different models. Even provinces within Canada have different models where they're allowing home grow. Some are allowing home grow, some don't. In Washington DC, you can grow and trade amongst your friends, but there's no money involved. So I think we have to look at all of those options. Do you allow homegrown? If you do, how many plants? Online. Do we allow online sales? So the neat thing around creating a regulated market for cannabis is that you get to do all of those things. You get to argue over the detail. At the moment, we've just let the criminal black market control all of this. Cool. If there's no more questions, can I thank you all? This was our first press conference. I hope you enjoyed it.